D9 definition again, very important. It prevents dislodgement consisting of a clasp assembly and a precision attachment, and it's very, very important component of a RPT. Classification, they are intracoronal, extracoronal. Intracoronal are precision attachments, extracoronal are occlusally approaching clasp, and gingivally approaching clasps. Now, how do the occlusal and gingivally approaching clasps look like? Occlusally approaching from the top. It's a push type of retention. They're less aesthetic, lot of metal. And what are gingivally approaching clasps? The ones which come from the soft tissue below, underneath. Pull type of retention, more aesthetic, can be used particularly when your abutment teeth in the anterior region, a canine, a premolar, first premolar. Then you can use a gingivally approaching clasp. Also, they are known as bar or roche, and occlusally approaching are called as acres. So all these synonyms are again very important for you to know, because any of the synonyms can be asked to you and you must be knowing that what means the same. What are the ideal requirements? Be it an occlusal or be it a gingivally approaching clasp, you must know what are the ideal requirements of a clasp design. Retention, stability, support, reciprocation, encirclement. That means at least you have to have a 180-degree encirclement, and passivity. That means your clasp cannot be active all the times. Otherwise, it's going to act like a passive extraction of your tooth. You don't want your tooth to be constantly, strangled by your clasp. So that's what it means. So these are again very, very important. A must mention when you're talking about a requirement of a clasp design. Now let's look at the pictures and let's understand how each of these clasps look like. Occlusally approaching clasp. As I said, from the top, they are the first very simple one is a simple circlet or your acres clasp. On your left, you can see is your embrasure clasp. Then you have your ring clasp down. And on your right again is your back action clasp. The less commonly used are the multiple circlet, the onday clasp, the hairpin clasp, the half and half, and the reverse circlet. Now, all of you must know these names, must know these diagrams, because you must know the knowledge of the classification of your direct retainers and how they look like. Your gingivally approaching clasp. They are the I clasp, Y clasp, T clasp, and the modified T. As per the alphabet, they have been, for simplicity, named, and that's how they have been designed as well, as very clearly you can see on your pictures. Combination clasp and aesthetic clasp are also the type of clasp. Combination is when your retentive arm is particularly, so this is your retentive arm. So when your retentive arm is particularly made of a wrought wire, which is more flexible, more particularly used in your distal extension cases, that's why it's called as a combination clasp. And that's your aesthetic clasp, wherein you can see that this looks purely, it's blending with the tooth. And when you want to particularly use it in a canine, then you can use these kind of aesthetic clasps. They are the acetal resin clasps or the thermoplastic resins, which are used as materials for aesthetic clasps. The RPI, very, very favorite. RPI concept, RPI class. Where do we use RPI class? Why do we use RPI class? It's an extremely, extremely favorite topic that each examiner would want you to know. What are the three possible moments? Now, before we begin and understand what is RPI, we all know that Kennedy's class 1 and class 2 are distal extension. What is distal extension? That means there is no terminal abutment tooth, and there is both your edentulous spans are distally located. Hence, because you have a difference in the resiliency, there's going to be moments. What are those three type of moments? The first moment is the one which is happening around the terminal abutment tooth. That means the entire denture rocks like this. This is your fulcrum line and it's rocking like this. Then you have another which is along the edentulous span and your denture is moving like this. And you have yet another wherein you're in the center, the axis passes and your denture is rotating like this. So these are the three type of moments which you very typically see in Kennedy's class 1 and class 2, which are your distal extension cases. Now, what does an RPI do? RPI, which was first given by Kroll in 1973 and modified in Krotokville. Again, Kroll and Krotokville. You must know these names. Whenever you write an RPI, you must know R stands for rest, which is mesial, because particularly rests in any form of other direct retainers are always distal. P is proximal plate and I is R bar. That's why the I bar. So that's why it's called as RPI, given by Kroll, modified by Krotokville. Very important, you must know these names. So what does an RPI do? The RPI, as you can see in this diagram, the rest is moved from the distal to the mesial here. So if the rest is here in an RPI very typically, then it prevents the heel raising movement. Very typically the heel raising movement which happens around the fulcrum line. That means it's lifting the denture base away from the tissue. So the heel raising movement is prevented by your RPI because of the shift of the mesial, shift of the rest from the distal to the mesial portion. There are modifications of RPI which can be also used, particularly when you have a soft tissue undercut. So the I bar is replaced by the Akers arm in case you have a soft tissue, though the rest remains always on the mesial side and the proximal plate is something which is going to be touching along the guide plane of the tooth. So you have the typical ideal RPI and you have a modification of RPI, which is an RPA. You must know about the movements of the distal extension partial denture. You must mention about the heel raising moment, as I spoke to you about here, that this is what it basically does, that prevents the heel raising movement, and this is how a typical RPI looks like. As I showed you a mesial rest, this is your I bar which is coming from here, and this is your proximal plate. A 3-point contact which is maintained, a 180-degree encirclement, and the basic aim of an RPI is to prevent the heel raising movement of a distal extension partial denture.